This is Dr. James with Helpmommy.com, and this is our third part of the 5-part series around 1-month-olds. And today I just want to talk about how they're eating. So a 1-month-old should only be drinking milk, whether that's formula or whether that's breast milk. They should only be drinking milk. The next question is how much? Well, in a breastfed baby, it's kind of hard because, there's not really like grit gauge there. And a lot of moms get worried because the amount of time that their baby's breastfeeding is getting shorter. But just know this is normal. Probably the longest you're ever going to breastfeed for most babies is when they're first born, because they're trying to learn how to do it. They really like that bonding. They're trying to get the flow going. Mom's production hasn't come in. But then as mom's milk production gets increased, as her flow increases, and as the baby gets more efficient at eating, the amount of time that it takes is much smaller. I have babies that sometimes it's only like 5-7 minutes on each side. Others it's 10 to 15. Some are just pokey and it may take longer. But don't be worried then thinking that the amount of time that your baby's at the breast equals the amount of milk they're getting. Because as they get better efficient and you get better flow, the shorter period of time is going to happen. So that's one thing that moms are worried about. The other thing is the amount that they drink in a bottle. It's an average. It's a range. They say that the best way to make yourself look like an idiot is write a parenting book. I've written 2. And the reason they say that is if you try and put a baby in a box, if you try to say this is the way that a baby should do something, you're making an idiot of yourself because there's such a wide range. But most babies at a month old are going to be somewhere between 3 and 5 ounces. I make the joke that if I'm going to bet in Vegas, it's going to be 4, because almost all my babies are on 4 ounces every 2.5 to 4 hours when they're a month old. But there's babies that are a little less. You may have a preemie baby, a very small baby. You may have a huge baby that's guzzling. How do you know if your baby's not getting enough? Well, when you go to the doctor, they're going to be measuring them. If their growth curves aren't growing along their curve, then we worry. How do you know if they're drinking too much? Well, a lot of times those are babies that are just greedy and maybe drinking until they vomit. So if they're drinking a huge volume and they're spitting up a lot, that may be a time that we may need to reduce them. And maybe they just like to suck on things, so we give them a pacifier instead of them just sucking needlessly on a bottle and just drinking too much. Now, around a month, they tend to have a growth spurt. So all of a sudden, instead of eating every 4 hours, now they want to eat every 1.5 to 2 hours. And this is especially important for breastfed babies. This lasts for about 2 weeks. The reason physiologically this happens is the increased stimulation to mom is going to cause her to produce more breast milk. The normal range at a month old, 3 to 5 ounces. The normal range for a 2-month, somewhere between 4 and 8. A lot of times a mom is going to nearly double the need of her production. And so that increased stimulation is what causes that to happen. Now, the bottle-fed babies are going to do the exact same thing because 1, it's physiology, but 2, during that period of time, they are actually having a growth spurt, and they're typically putting on about 1/2 pound to 1 pound per week. So they are growing fast. So hopefully that covers the subject of how much and how often your baby is going to want to eat around the time they're a month old.